Hello and welcome to the third CAH Talks. Today's podcast is slightly different in that I'm going to be talking about the sustainability challenge for charities. How do charities survive, thrive and prosper in the current environment? Charities in the UK very simply break down into three kinds of charities. You have national charities that have a remit across the entire country or even across the United Kingdom, operating in all four nations. Then you have regional charities, specifically focused on a particular geographical area that's bigger than one city or one local authority area. And then you have smaller charities and voluntary sector organisations, traditionally located within one local authority boundary. And today I'm going to talk about the sustainability challenge for the smaller charities who traditionally are located in one geographical area or one local authority area and have very tightly defined boundaries about who is and isn't eligible for their services. For those charities, I think they face three main challenges at the moment. Firstly, increased demand. With the cost of living crisis, those charities are seeing client numbers going through the roof. Citizens Advice Haringey is on average taking about 2,500 calls a month. So for those charities, demand is increasing rapidly. Those charities face rising costs. So rising energy costs is a big thing. And since the last budget, rising staffing costs with employer national insurance contributions rising significantly. And that's combined with reduced funding from local authorities, reduced funding from grant funding organisations. So you can see there is really a triple threat to the long-term sustainability and survival of local small charities. And I think this current situation really challenges the business model that a lot of these charities have grown up relying on. And that business model is to seek funding from the local authority, win a medium or large size contract from the local authority, and rely on that contract to fund the entire organisation. What we've seen since 2010 is a reduction in central government funding to local authorities around about 35%. That has meant in turn a reduction in funding that is available from local authorities to these kind of charitable organisations that operate specifically within one geographical location or one local authority area. Indeed, we've seen across London where some local authorities have gone bankrupt and issued a Section 114, they have simply ceased providing any funding to local voluntary sector organisations, which has had a dramatic, catastrophic impact on the ability of that sector to sustain itself and to survive. So I think it's fair to say that the current financial situation that we find ourselves in means that the business model that small, medium, local charities have relied on for the past 30 to 40 years is no longer a viable business model. It is no longer sufficient to rely on that business model for your long-term sustainability, for your long-term survival. So charities now have to start looking at developing a new business model, a new way of securing funding, if we are going to survive for the next 10, 15 and 20 years and meet the rising demand that is clearly there, that is clearly relying on our services as we move forward. So what I'm going to suggest is a few options, a few things that we've looked at Citizens Advice Haringey in order to move our sustainability on, in order to survive and to prosper over the next 10 to 15 years. The first one is very simple, but has quite dramatic effect. And that's to think about where you are storing your money. To think about as a charity, is keeping all of your money in a high street bank the best way to earn money around the money that you have saved? The interest that high street banks pay is not that high. There are other ways of making your money, your reserves perhaps, work for you. One of the things that can be looked at is whether that money can be used for investments and whether those investments can grow the amount of money that you have saved, thus providing a different kind of business model, a different source of funding, moving you away from reliance on local authority funding. Investments can provide what's known as unrestricted funds, funds that can be used to provide staffing, that can be used to plug gaps, that can be used to maintain someone in post in between the funding for one project ending and new funding coming on board. So thinking about where your money is, what your money is earning for you, what you can get out of that money that you are saving is one way that local small charities can start to think about developing an alternative business model. One of the other things is to look at where in our society currently there are funding opportunities. If previously you have relied exclusively on local authority funding, are there different areas that can be explored? Are there different sectors that may have funding opportunities? And one of the areas that we've looked at is the NHS. The NHS is no longer organised along local authority boundaries. The NHS is now organised around integrated care boards. So where we work, our integrated care board covers Haringey, Enfield, Barnet, Islington and Camden. Are there funding opportunities that arise from working with your local NHS across that broader regional structure? We are exploring with our integrated care board what potential funding opportunities there are. So again, for small charities, thinking about who you could work with outside of your geographical areas in that NHS region may open up funding possibilities that no longer exist at local authority level. So once again, trying to build a sustainable business model that removes your funding from just being reliant on local authority funding and local authority grants to a more balanced picture. So definitely looking at the NHS for what possibilities there are there. In order to do that successfully, you need to think about how you deliver your services. What are the gaps in terms of NHS provision and how your services could contribute to the outcomes that the NHS is trying to achieve. But if you're able to do that successfully, you are able to operate in a different space with different funding opportunities. That leads on neatly to, I think, the next issue, the next opportunity for small charities. Particularly in London, I wonder whether continuing to just operate in one local authority area is sustainable or feasible moving forward. Do we need, as small local charities, to start looking for partnerships across broader geographical boundaries? So that could be for us looking at North London. That could be for us looking at London as a whole. That could be looking at into Hertfordshire for partnerships and potential opportunities. There are many kind of regional groupings that we could explore. What we know from people who fund charitable services is they would much rather receive one well thought out, well written bid covering a region than receiving 6 bids for the same region, all essentially saying the same thing. For funders, regional bids allow them to make their money go further, have a broader, much wider impact, and to promote the sustainability of more than just one organisation. So maybe it's time for us as a sector to start thinking bigger and broader than just our local authority boundaries. Start thinking about what partnerships there are that make sense for the people we work with outside of our geographical areas. Which leads on to the next point. If we are working in a regional or an area with lots of other charities, why are we buying the same services individually? Why do we buy our own IT, rather than getting a regional IT contract? Why do we buy support individually for our IT systems? Why don't we combine and get a bigger contract for our IT support? Our audits, we all do that separately. Our employment insurance, we all do that separately. So maybe by thinking regionally, we could achieve better economies of scale. Small charities work on yearly budgets that need to show a small surplus to sustain the organisation. So saving a couple of thousand here and 300 or 400 there could soon add up if we were to approach these things regionally or with partners, would make a huge difference to our ability each year to bring in enough money to provide the services that we need to provide in order to meet that increased demand. We need to think about more partnership working. How do we work in a much broader and much open way with other organisations that have similar values and similar client groups to us, not only to achieve funding opportunities, but also in order to ensure that the clients out there get the services that they need. So again, if we are going to move forward, thrive and prosper, we need to think about more partnership working, bringing each other's resources to the table to produce a wider service. The people that we work with, their lives don't neatly fit into the boxes that we've organised ourselves. People aren't just an older person or a person with mental health issues. People's lives are complicated and cut across those issues. So if we can make more relevant partnerships and use those partnerships to provide more and more services, to access more and more funding, not only are we promoting our own sustainability, but we are providing the services that those people who need our services can really use. That helps people who commission out and fund our services to avoid duplication, to have better outcomes for people in their community, and to spend the money that they're saving on new services. So it's a win-win, but we need to move into that realm of partnership and working across client groups, across interest groups, if we are going to survive and prosper. We also need to think about mergers. How do we actually rationalise the services that we have? How do we bring together organisations that would struggle on their own, but together would be more compact and more resilient to the challenges that we face? So charities actually formally coming together, formally thinking about how they can occupy a space that gives them more that they can offer to those people who need us. Now, maybe that last one is some distance to travel, but maybe that's what we need to start thinking about. If we are going to make the most of ever diminishing resources with an ever increasing client group, maybe that is the road that we need to travel. The days of just relying on a contract from a local authority, as I said earlier, maybe those days have gone for good. So it's very, very clear to me that the charity sector, particularly smaller local charities, need to think differently, need to think bigger, and need to think across regions if we're going to survive and prosper for the next 10, 15 or 20 years. And what's clear to me is this thinking needs to happen now. This isn't an issue we can start thinking about next year, the year after, or in 5 years' time. If we're going to still be here, then we need to start thinking about these issues now. Thank you.